So we have about 58 minutes and 10 seconds to go for the Prime Minister to start speaking, and before that we'd like you to have a full sense of the challenges that the Prime Minister and we as a people have to deal with just ahead of the Prime Minister's fifth address. I'll walk across to the Corona India dashboard of the India Today Data Intelligence Unit, and I'll show you a global picture of where we are at in this battle, and then we'll come to what's happening in India. At this moment, globally, there are 4.19 million confirmed cases of the coronavirus. There have been 286,000 deaths. The United States continues to remain most impacted. After that, there's now Russia and then Spain. Let's now come to the India picture. In India, there are now 70,000 plus cases. There have been 2,293 deaths. 22,000 people have recovered so far. Let's get into a state-wise breakup. Maharashtra, far and away the most impacted state even at this moment. In Maharashtra, there are 23,000 cases. That's about 30% of India's total cases come from the state of Maharashtra alone. 868 deaths, 4,700 recoveries. Now the problem is Tamil Nadu, which was not in the top three so far, but suddenly crossing 8,000 cases, 53 deaths, the number of deaths mercifully low, and 2,000 recoveries. Gujarat is at number 2. In Gujarat, 8,500 cases, 513 deaths. Delhi is the fourth most impacted, even though it's much smaller in size in comparison with Tamil Nadu, Maharashtra, 7,200 cases, 73 deaths. I want to show you now where India stands in comparison with the rest of the world. So if our producers can zoom in the United States, there are 13 lakh cases, 1.3 million cases. In India, mercifully, the number of cases is just 70,000. So while, of course, we've been badly hit, but if you look at the overall picture, in a country like Spain, there have been 2,27,000 cases, Italy, 2,19,000 cases. India, despite the density of its population, despite weak healthcare facilities, still doing quite well. I want to show you now how does the number of cases in India compare on this curve. This is the World Trajectory Tracker curve, and here is where the problem is to my mind, and I'll explain why. So just bear with me as I take you through these numbers. This line represents China, the orange line. They've been able to flatten the curve quite literally. So it's not an epidemiological term, it's just a very straight term. You've flattened the curve. The problem in India is that the curve is still headed upwards. So we are still in what doctors call the growth phase of the virus, as is the United States. This is, the blue is US. So the US is also in the growth phase, and so is India. Whereas if you compare with Italy, Italy is this green line. They've been able to flatten the curve. I'll pull the Indian curve out again. Just see, it will come on your screen right now. The orange curve shows that the curve is still heading upwards, and that's the challenge for a country like India. Within India, and this is where things get very, very granular, because in every state the circumstances are different and the challenges are different. So this dotted line reflects the line that the cases would be growing by if the number of cases was growing every 7 days. Now the curve which is the sharpest, the most angled curve, is the curve which is the biggest problem, and that problem is in Maharashtra, the blue curve. That's the curve with the greatest incline. The blue curve has the fastest rate of growth. At number 2 is Gujarat, this saffron curve. That's the number 2 curve, right below Maharashtra. But again, if you look at the incline, it's almost like that of Maharashtra. Now the problem is, and this is what I fear, this red line is Tamil Nadu. For a long while, it's really been very, very moderate. It seemed as if the problem was under control, and suddenly, from about the 24th day onwards, there's a big spurt. And now this is heading in a direction where if it continues, at least at the speed at which it's growing, it could go beyond Maharashtra. So Tamil Nadu at this moment, if you ask me, at this moment, Tamil Nadu is a big problem area. Here are the number of new cases and where these cases are coming from. Now this data set is very illustrative because it shows you where is the maximum problem erupting at this moment. For the longest time, the maximum number of cases have been coming out of Maharashtra. The number 2 spot keeps changing. For a while it was Delhi, then Delhi slipped and Gujarat became the number 2 spot. At this moment, the number 2 spot is Tamil Nadu, where there have been 798 cases on the 11th of May. In Maharashtra, there are 1230. At this moment, if there's one state you have to worry about most, it has to be Tamil Nadu. Gujarat, 347 cases, Delhi, 310 new cases. Now I will show you the latest heat map of what India looks like. Now this is something we are working on district by district, state by state. Data analysts plot this. The problem here is that there is so much more red now than earlier, and most importantly, there is so much more saffron. So this pale yellow saffronish color, 418 clusters with a few cases. So if you remember from our previous illustrations, and we'll show them again to you, there was a lot of green in a lot of Middle India, East India. Now there's a lot of saffron. So 418 districts with a lot of saffron, only 179 districts, which was earlier above 300, which have no cases. That's the problem. So the disease is clearly spreading, and that is something to look out for. Now, have we been able to flatten the curve? You'd remember this one illustration that the Niti Aayog put out, which said by the 16th of May, the cases will be down to 0. That's not the case. The number of cases keeps growing. So the yellow represents confirmed cases, blue represents recovered cases, deaths is in red. So the good thing is that the number of confirmed cases is strong, which means a lot of people are recovering from the infection, which is great. But as far as the country is concerned, the curve is still going upwards, and that is the problem. Because, Rajdeep, and this is crucial, if you look at how many cases there were when the Prime Minister first spoke, and I just did some number crunching before coming into the studio, I'll just take you and our viewers through this, and then you compare with what's happening right now. When the Prime Minister first spoke,
that's 21st of March.
There were, when the Prime Minister spoke on the 19th of March, there were 173 cases. When the Prime Minister spoke 5 days later, on the 24th of March, there were 519 cases. On the 3rd of April, there were 2,308 cases. When he spoke on the 14th of April, there were 10,363 cases. On the 12th of May, as he speaks in about 51 minutes from now, there are 70,000 cases. So the disease has gone deeper into our society.
That's the bad news. The only good news that I saw from that graphic was the mortality rate. What is very clear is the recovery rate is steadily going up, as was expected. But importantly, the mortality rate in India is well below the world average. At the moment, we are about 3.4%. The world average is a little over 5 in some countries. Some countries, of course, have taken it above by 7-8%, but 5% is a global average. We are at 3.4%. Now, that's where the political risk comes in. What is the risk that Prime Minister Modi is willing to say? What is the acceptable risk? Now, you could argue one death is one death too many.
But can I play devil's advocate and say...
How far does the Prime Minister go today in trying to give India a picture which is of the glass half full?
But do you remember the story our reporters did from Delhi, where they went to every hospital and they asked them how many deaths have been reported at your hospital because of coronavirus? The total number added up to 130 plus. The Delhi government at that time was saying just 60 plus. So what do you classify as a death because of coronavirus by itself is contentious? Because the person could die of diabetes, heart attack, any other problem. Do you call him a comorbidity patient, or do you call him a COVID patient?
You see, for the longest time, Bengal's numbers were low because the Bengal government was saying that the case must be a confirmed COVID case. They were not treating comorbidity cases as COVID cases, which is why the numbers in Bengal appeared rather impressive. The moment Bengal started accepting that comorbidity cases will have to be treated as COVID cases, the numbers have gone up. Number two, and I think that is critical, is testing. I think Sachin Pilot made the point that you will see a wide variation. In Tamil Nadu, for example, they are among the states which have now started to aggressively test. Mortality rates in Tamil Nadu, Rahul, are below the national average. Maharashtra is aggressively tested, so has Delhi. So in your top 5 states, most of the states that you see, including even Gujarat in the last couple of weeks, are states that have tested aggressively. The worry is what happens, as you said, if migrant labor, as they now start going back to rural India, will you be able to test as aggressively there? Will those numbers become even more worrying because the health infrastructure there is nowhere comparable to the cities? Today, 12 cities account for more than 70% of the cases. As you look at those orange, you see the orange now is coming in some of the poorer parts of the country. Earlier, it was largely red and orange in the so-called market-friendly coastal parts of the country, with Delhi and Rajasthan and Madhya Pradesh also there. But now it's spreading across the country. So again, it comes back to it. What is the risk, political risk, that you can take where you can go and tell the people, look, we've got 10 lakh corona cases, but out of that, only 3% is our mortality rate. Can any prime minister or any leader say that with a sense of conviction? Very easy to say, let's live with the virus. But when you have to live with the virus, the political costs of that are such that that's what the prime minister will have to look at.
I've got some breaking news coming in. This is about, and this is something that everyone's been looking forward to. There have now been a bunch of draft guidelines that have been put out for what flights could look like in the post-pandemic era. So when India starts opening up, the Ministry of Civil Aviation has put out some guidelines, and the last 3 rows will be kept vacant for isolation. There'll be a secondary temperature check by the airline at the boarding gate. You won't be given any meals, so if you have a 3-hour, 2-hour flight, that's something to think about. You won't be allowed to carry any check-in baggage. Water will be available in the gallery in cups and bottle. No CISF stamping of boarding passes. And at this moment, Ajay Singh joins us. Ajay Singh runs SpiceJet. He's been in constant dialogue with the government about what civil aviation norms will be. The draft guidelines being put out this evening by the Ministry of Civil Aviation. Can you give our viewers, Ajay, a sense of what to expect if I need to board a flight once they start in a couple of weeks from now? What should I expect if I'm flying SpiceJet?
Well, Rahul, firstly, I want to say that in our opinion, flying is probably the safest mode of public transport that you will find, far safer than, of course, going in buses or trains or metros and so on. It is a controlled environment. You are sitting in that controlled space, and you can do plenty to clean that space and plenty to make sure that people are following certain rules. I think what the government is trying to do is to gradually lift the ban that we have on flying, as a measure to get the economy going, people back to their homes, some business travel that needs to be done, but do it in a phased manner. So not to start all the flights all at once, but to do this really gradually. And with all the precautions that they can possibly take. And amongst those precautions, like you said, is temperature control. Look at passengers and see if check their temperature as they come into the airport. Ensure that everybody is wearing a face mask as soon as they step into the airport, and they keep that on right through the journey. Other measures like web check-in, which has been spoken about, that all the check-in will be through the internet. And so there won't be, hopefully, any queues at the check-in stations. That the baggage drop will be as digital as is possible. So a bunch of measures.
Well, one second. How do you digitalize the baggage drop? It sounds very fancy, but how does it happen? I mean, from what I know, somebody who goes, he picks up the baksa, he puts it on a carrier, and that's how it comes, and then a human being picks it up. So you're digitizing it how?
So what you would do is that at least the passenger, as he walks in, would drop the bag and be on his way. He would not hang around there in a line, interacting with other passengers, waiting for a receipt to be given to him. That receipt will now be transferred digitally to him, via an SMS or email, and that's it. So he just comes there, drops his bag, and goes. There is no weighing of the bag. There is no hanging around for getting a receipt. So that's something that we need to attempt, I think.
So how soon do you believe that the skies will open for domestic travel? Are you telling me that if the Prime Minister today announces that we are opening up the airlines, you are ready as of tomorrow morning?
Well, we are absolutely ready, Rajdeep. We have been working through some of these measures for a period of time. Of course, we do still need a bit of time to procure some of the safety equipment. For example, these face masks that will be given to passengers, and perhaps sanitizing fluid and perhaps a face shield. I think airlines will be procuring that over the next few days. But certainly, if the Prime Minister was to ask or was to tell us that we need to start flights, we will probably be ready starting.
Why is hand luggage banned? I don't
Starting
understand
Monday.
that.
You're
Starting
saying
Monday,
Starting
yes.
Monday. So you're hoping that the Prime Minister will announce that from the 18th, we don't know whether he will announce or the Civil Aviation Minister will announce that from the 18th, now that you've got a Rajdhani between Bombay and Delhi, you're hoping that Mumbai,
No,
Delhi
but Rajdeep,
will have
there
a
are few
flight.
things we have to contest. One, Ajay says that flying in an airline is safe, but it's actually the same air. If I'm in a bus or in a car, I can roll down the windows and fresh air is coming in. This is the same air. So if somebody's sneezing, somebody has even if he's asymptomatic, he can spread it. Actually, being in a closed aircraft is not particularly safe, Ajay. I don't know how you're saying it's safer than other modes of transportation at this moment.
Rahul, this is a very common misconception. I don't blame you for having it, but what happens in an aircraft is that air is actually circulated from the roof to the floor, and it escapes through vents in the floor. So it doesn't really get circulated in the cabin. There are HEPA filters, which are the same filters which are used in hospitals to ensure that as the air passes through the floor, that air is thoroughly cleaned. So there is absolutely no chance of circulating air causing infection in an airplane. This is not something which exists in either a train or a bus or a metro. So both manufacturers for airlines, Boeing and Airbus, have the system installed on all aircraft already.
And lastly, before we let you go, what's the logic of not allowing people to carry hand baggage? How does that make things any safer or more unsafe?
I don't know about that. I don't know about that because from our last discussion, I guess the idea could be that people will stand in aisles and try and put those bags, in the cabins, in the boxes above. But in our view, you should allow one handbag.
Okay.
The government should allow one handbag. They have already restricted. I think they're talking about restricting the check-in luggage to one bag. I think they should allow the handbag.
For joining us on this very important story, which people were looking out for, on what new aviation norms would be, what to expect when you're flying next. Ajay Singh from SpiceJet, thank you very much. I deeply appreciate your thoughts. We want to go across right now, Rajdeep. Gaurav Bhatia joins us from the Bharatiya Janata Party.
And Supriya Srinath of the Congress. Remember, one of the issues that could come up is, and there's been a big buzz about this in the last couple of days, is an economic package. The much awaited economic package that we've been waiting for weeks. And there's some talk that it could happen in the next 48 hours, a package for micro and small and medium enterprises. Will the Prime Minister give any indication of that? How important is now the economic emergency, if one may use that word, that's confronting the country? Supriya Srinath and Gaurav Bhatia. Supriya, you first. Is the opposition or the Congress in particular now wanting the Prime Minister to lay out a blueprint for the revival of the economy? The focus in his first three speeches, particularly the first two, were largely on the lockdown and the need for a lockdown. Jaan hai to jahan hai. Do you believe that that message now needs to change?
I think we've believed that for a while now. The Prime Minister has to lay out an economic blueprint for the revival of the Indian economy. While we fought the corona crisis on one end, numbers have gone up. Like between you and Rahul, you were discussing how the numbers on the day of announcement were 525. We've crossed 71,000. But there is a huge collateral damage done to the Indian economy as well. And there is going to be an economic and a life cost to this. So we've been of the view that the second stimulus package, which we have been waiting for a while, needs to be announced today and not tomorrow. It is not just MSMEs that have to be on the government's radar. I think the biggest human travesty of our times is the condition of migrant labor, and we have to talk about a direct benefit transfer to them, whatever form the government wants to do it in. But if that is not going to be tackled, then we can't have lakhs of people just walking on the roads and the highways, and many of them actually dying of accidents and starvation and hunger. So I think the economic part of the corona crisis, the impact has to be dealt with today and not tomorrow.
Gaurav Bhatia, in his first speech, or post the first speech, we had this announcement that was made of an economic package, about 1.7 lakh crores, and it included cash transfers through using presumably the Jan Dhan Aadhaar system, but many of them don't seem to have got access to it. particularly the urban poor, which is the reason why they are leaving. Now, the Prime Minister at some level, does he need to address this crisis today? It cannot be now left to tomorrow. Or is that to be left to a finance minister to come up with an economic package that could include something far more meaningful?
So, Rajdeep, I think the entire nation today is waiting for the Prime Minister's address. And let us understand, the Prime Minister plays a very vital role in our democracy and as per the Constitution. He is the guardian-in-chief. He had a marathon session, the 5th meeting with the chief ministers of the state. What does it reflect? It reflects that in the spirit of cooperative federalism, he is consulting various state governments as well, and then he takes the final call. But let us understand, there would be conflicting claims from different states, and the Prime Minister has to take a decision which is in the best interest of the nation. I'll give you an example. In yesterday's meeting, Punjab and Jharkhand asked for an extension of the lockdown. But Rajasthan and Chhattisgarh said the lockdown should not be extended and the lockdown should be limited to the containment zones. Now, who reconciled these differences of opinion? It is the Prime Minister. The Prime Minister is being very ably advised by an expert panel. He is aware of the challenges that we face. But you said there is bad news. I would like to say there are a number of good news also. The way this country is moving forward and, facing this challenge. Like,
sir, at this moment, Mr. Bhatia, at this moment, there are lakhs of people in different parts of our country, poor urban migrants, who are desperately making their way back home, either by truck, by cycle, by auto rickshaw, by literally any means they can find, some of them walking hundreds of kilometers. My question to you tonight is this: what has taken the government so long in announcing a second stimulus package? We have had the world's most stringent national lockdown, and relatively speaking, in a global context, amongst the smallest packages as a percentage of our GDP. And you've taken 50 days to come up with a second package. What is holding this government back in showing the boldness and decisiveness that you're famous for?
Okay. So, Rahul, I am assuming that as a very responsible journalist, you are also aware that the resources of the central government are also limited. And it is a responsibility that has to be shouldered by the central government and the state government also. The central government has announced a package of 1,70,000 crores, also spending on sprucing up healthcare. Now, can I ask on the program to the Congress spokesperson, what is the state package that has been announced by the Congress government? Yes, migrant laborers are our priority, and that is why trains have been started. These are all special trains. Bus service has been provided. The migrant laborers included were also provided with ration. 60 crore.
I don't know how you're trying to draw an equivalence, Gaurav.
Can I please
You
come
have
in?
the money, the resources are with you. Let Supriya
Can I
respond.
please
But
come in?
how can the central government's resources be compared to the states? Paisa sara aapke paas hai, sir.
No.
Okay, let Supriya
I
respond, then we'll build on this. Supriya.
Please allow me. Please allow me.
No, let her respond. Let her first respond. Yes, go ahead, Supriya.
I think Mr. Bhatia has made a grave error by pulling me into this discussion, because I have a very fair idea of the finances of the central and the state government. So first things first, it is not just the Congress ruled states, but even states ruled by the BJP have written letters asking for more economic and fiscal help from the central government. Let us, for the viewers, keep it very simple. The elbow room to borrow, to raise funds, to have those funds available is much higher for the central government than it is for the state government. Experts after experts have said that if states borrow at the cost at which they are being made to borrow, they will all get into debt default, and this will not just be restricted to Congress ruled states, even BJP ruled states. The GST money has taken months. The whole thing has still not been disbursed. The WMA limits raised by the RBI, 8 to 9% is going to push these states into debt default. Every state has asked for fiscal help. Money aapke paas hai, paisa aapke paas hai. You can't look away from that. I don't want to politicize this matter, but do not compare the fiscal position of states to that of the center. You also have leeway on the FRBM that the states don't have.
You want to very quickly respond, Mr. Bhatia, because even the GST numbers for the month of April have not been announced. Your collections, you are constitutionally mandated to reveal them in the first week of every month. That has not happened. Most states are saying you've not given the GST money. I had Captain Amrinder Singh the other day on the program saying he hasn't got enough funds to fight COVID. Is there another challenge also of providing resources?
What about the PM CARES fund? Where is that money? Why is that money not being used now? Today is the rainy day. Today is the deluge. What is that money being saved for?
Okay, let him respond. Let him respond, please. Give him a fair chance to respond.
Yes, thank you. Thank you, Rahul. So, I think, probably the Congress spokesperson is not aware of the kind of resources that have been provided by the central government to the state government. 16 lakh PPE kits, 32 lakh N95 masks, 1 lakh 70,000 crore package. On top of that, the positive side is, and that is what I was referring to, the recovery rate is 35%. Just 7 weeks ago, the doubling rate was 3 days. Now it is 12 days. And that is why I'm saying the government, central government, is very well aware of its responsibility to provide funds to the state government and also respite to the laborers, farmers. But at the same time, the resources are limited and we do not know how long this fight against COVID would last.
Sir, at the moment, even for Shramik trains, you are asking, just a minute, Supriya, even for the Shramik Seva trains, you are asking the state governments to pay for it. Why should the, just a minute, why should the center, what is the PM CARES fund for but for this? Why not use the PM CARE fund for providing trains?
You got to give me a fair chance,
Okay, let him speak.
And stop interrupting me. Stop interrupting me.
You're not answering the question.
Please, your question can wait and so can you. Your question can wait.
Okay, go on, go on. We are happy to hear from you. Go on.
Thank you. So all that I want to say is we have seen how the central government has been flexible enough to accept good suggestions, even from the Congress-ruled states. You are aware that trains were not operating. The trains and the buses were not operating, and then we eased out. Even in the red zones, there are relaxations, and today is a very important day because I think taking stock of the situation, the Prime Minister will take a holistic call.
You're making migrants in Gujarat pay 700 rupees for a ticket. Why should they? Why can't that be fully subsidized by the PM CARE fund?
Rajdeep,
Why should a migrant have to pay? A
all.
migrant labor who's lost his income for the last 7 weeks is being made to pay 700 rupees for a ticket. Why? Why should the state governments pay for it? Why can't the center pay?
Bear with me and answer. I'll answer that. See, first of all, there might be aberrations. They are not only from Gujarat. It happened in Maharashtra. It happened in Chhattisgarh. But please do not interrupt in between. Maintain the civility. Please.
Go ahead.
Yes.
Very quickly,
Yes. So now let me make it very clear. For the train ticket, 85% is being borne by the central government and the railways. 15% by the respective state government. But Sonia Gandhi comes out and says that the Congress state units will take, the payment on their own shoulders. I ask you, when 85% is being paid by the central government, 15% by the state government, how can the state units pay for it? And second, if the state units of the Congress are to pay, Rajdeep, then why couldn't the state governments, where there is a Congress-ruled state, make an announcement earlier that we will take care of the entire fare?
Okay,
So
let's not make this about, I don't think a migrant labor is interested whether Sonia Gandhi pays the money or whether Narendra Modi pays the money. He wants someone to pay for it. And the fact is they've been made to pay for it. Supriya Srinath, very quickly, at the end of the day, do you believe that the Prime Minister in his address today must now ask the state governments in a way to take the initiative? State governments want greater powers. If they want greater powers, they need greater resources. But importantly, are they willing to take the risk of opening up their states? Is a Chhattisgarh, Rajasthan,
to get into the
Maharashtra,
generalities that the BJP spokesperson is getting into. We need to talk bare bones specifics on a day like today. Yes, states need to have the flexibility to decide which are the red, orange, green zones because they are prima facie the first to receive the data. The DM is the first to collect the data. He should have that authority and not New Delhi. But New Delhi cannot run away from its responsibility either. I mean, when cases are at 71,000, you just can't say today that let's state decide everything and we're going to run away and watch the fun.
Miss Srinath, you have two Congress. No, Miss Srinath, you have a Congress. You have an. Just a minute, ma'am. Ma'am, I want to understand this. You have you.
Forget about 85 and 15%.
You have a Punjab, ma'am.
Srinath, why did it take you 36 days to wake up to the plight of migrant
See, Supriya has been a TV anchor, so she's giving everyone a hard time.
Supriya, very quickly,
but
you have a state like Punjab where your chief minister wants the borders sealed, and you've got other states which are talking about opening up the borders like Chhattisgarh. I want to understand, there is no consistency even within the Congress as to whether borders should be sealed or not. Let's be very clear. This is a very complex problem.
There cannot be consistency between states. These are different states. They cannot be one size is not going to fit Rajasthan, Punjab and Chhattisgarh just because they are Congress rules.
I don't want to spend all our time in the build-up to the Prime Minister's big address caught in this.
They are BJP rule states. You've got to give state governments flexibility. The role that the central government needs to play is to ease the supply chains even when borders are sealed. That is a very big responsibility and the centre needs to rise up to that.
I want to welcome to this broadcast Dr. Naresh Trehan, one of India's best-known doctors. Gaurav has had many charges thrown at him, so I'm going to give him 20 seconds to respond because I also want to get a medical sense on where we go from here. Mr. Trehan, Dr. Trehan, welcome. It's great to have you with us. We're seeing the kind of face-off that's playing out politically from a medical perspective. You know, many people are saying this feels like Abhimanyu in the Chakravyuh. We've entered the Chakravyuh. Now everybody's wondering, how do we get out of this Chakravyuh? So if you were looking at India as a patient dealing with COVID, what would your prescription be, doctor?
So, you know, we are not alone in it. The whole world is perplexed with what to do. Now, for every country has its own peculiarities, like we have, some were unexpected, some are expected. Now, the perplexing question first today is that life and livelihood question that keeps being bouncing around. That unfortunately all these debates are still getting so political where the nation is really in need of some definite cohesive leadership. So here we are, we locked up the labor for 5 weeks. When time comes to try to open up the industries and all that, the labor is going back. Now that is something everybody is wondering why it happened. And what was it a plan or is it something that we are not aware of, that the pressure was building so much that it happened? Okay, it's happened. Now, at least the migrant labor goes back. Industry is supposed to expected to mobilize their workforce to start economic activity, which we must. So the point basically is we need to open up because otherwise the pressure from below will be huge. India does not have the resources to be able to feed people for another 3 months. I think the point what we need to concentrate on is which are the areas which we open up, which are going to, if they are going to cause damage, is the least damage and controllable damage.
So let's get more specific. I want to press you further. Out of the generality, let's get into the specifics. What do you think we can open up? What should we not be opening up? If you were the Prime Minister, if you were advising the Prime Minister on what to say, what would you be telling him, Dr. Trehan?
I hope that they will not come, but the point is we opened up the agriculture sector. This is now over 2 weeks. We should assess what have we accomplished in those 2 weeks as far as agriculture is concerned. Have we been able to provide the movement from field to plate? If we have not been able to, what is our lessons? And what damage have we done along the way?
No, I think the point, Dr. Trehan, is, you know, the new one-liner that a lot of chief ministers also reportedly used yesterday is we have to learn to live with the virus. Jagan Reddy, Arvind Kejriwal, KCR. The question is, how do you live with the virus? As Rahul showed in his graphic, the numbers are rising. The mortality rates remain low. The recovery rate is growing, but the numbers are also rising. Can you live with the virus by only focusing on the containment zone? Because today's containment zone may be, say, zone A. Tomorrow it will be zone B. So orange, what is green today is turning orange tomorrow, which will turn red the next day. So how long can you do this color-coded India as an exit plan?
No, as a starting point, it's okay to do that. But the point is, numbers will rise. They're probably double of what we know today, or maybe many more times what we know today. Living with the virus just means one thing, that life will, till we get rid of this virus or we have vaccines which will give us immunity, we will have to live with those three things that we keep talking about. There are only three things the population can do. If the population is responsible today, we can open up with minimum damage. The point is everybody observing those three mantras?
What are your three mantras again?
No, hand hygiene, the masking and distancing. These are the only things the people can do.
But that's not happening on the ground. No, Dr. Trehan, let's see what's happened when the moment the Prime Minister on May 3rd in his last speech gave a sense that he was relaxing some of the stiff conditions of the lockdown. You saw what happened outside liquor shops, outside train stations. There was no social distancing to speak of. So let's be very clear. We are a 1.38 billion strong nation with a high density of population.
So if we cannot convince the public, and that's what I want to not to be misunderstood, that we have to live with the virus. People are thinking, oh, we have to live with the virus, so we might as well let ourselves go. Whatever will happen, will happen. That's not what the message is. The message is very clear. Live with the virus means you have to alter your lifestyle. You have to mentally alter yourself to say, how do you protect yourself, your community, your family, your country? This is a public war. We are the warriors as the medical frontier. But alone, we can only take care of people. Now, one more important point that there is, when we open up, in what graded, calibrated manner we open up, cases will increase. The velocity with which they increase is going to determine what's going to happen to this country. And mark my words, if this lockdown has helped to slow it down, it has helped to prepare ourselves for proper medical facilities being available. We are ready, but we are ready not for 1.3 billion people for it to run through it. Sir. If 10% of the population gets, we have 1.3 million beds today, we'll need 2.6 million beds, even if 10% of the population gets it. But the good parts are 80-85% are getting mild symptoms or no symptoms. If that is the case, that will run through, and the cure rate that you are seeing on the charts is representative of that. So it's a 2-week cycle. If we can slow it down in a way that when people get infected, and most of them are not symptomatic, but that 15% that are symptomatic and 2-4% who will need ventilators and intensive care use, if the amount coming out at us is limited in the sense of like measured. If the whole country gets sick together, it's not right. So I'm saying there are
but can I press you to tell us what you think should be done? What would you like to hear the Prime Minister say? Tell us that, sir. What's possible? What's our best strategy?
You know, there have been inputs from the medical fraternity. There have been inputs from the business people on how to open different industries and different ways. But now the biggest danger is if we are going to transport people on trains or planes from hot area to hot area or hot to non-hot area, we are going to have major problems. So it's not the travel part. In airlines, I've said already, if we have masking, if we have gloves, if we have distancing, the middle seat being empty, everything done slowly, at least it's a 1 or 2 hour flight, and the airline should not save on the air circulation, because they can calibrate it according to, you can save fuel by using it less. Now get it full blast, let the air travel. That's the least risky of travel today. But where are you going? If you're coming from Mumbai to Delhi, Mumbai is so hot that those people may be carrying it and bringing it here, so there's no way of knowing. Just measuring temperature doesn't mean anything. Should we have COVID testing the day before you travel? Maybe. If there is enough testing available, you travel, you're negative, you go on the plane.
Sir, we have all the questions. We want you to answer them, Dr. Trehan. You are giving us questions. Rajdeep and I have all the questions. What do you think should be done? If people are going to fly...
Open it when you have the facilities to safeguard. If people are going to be on a train for 24, 48 hours, that is a very dangerous thing, I think.
But the fact is, but look at the irony of it. Look at the irony of it, doctor. The fact is, trains have been opened up, passenger trains are opened up, but we haven't opened up airlines. Now the question is, therefore, at some stage, someone has to bite the bullet. Is today the day for the Prime Minister to bite the bullet? He bit the bullet
Yes.
7 weeks ago and said, look, I'm going in 4 hours for a national lockdown. There will be critics who say he gave only 4 hours. There are others who say it was an extremely effective way of putting together a lockdown. Now, 7 weeks later, can you still say, look, I need 2 more weeks to get the infrastructure together?
No, I don't think that you can afford to get the whole country locked down for another 2 weeks. It's seething under the lid. We need to continue the process that we are following. Numbers will go up. We will have to be again and again, day and night, be stressing on people and enforcing the 3 effects that we have to have on everybody. Do not do things like opening a liquor shop. All the liquor shops are open and you don't know how to control the crowd out there. Then why do it? That's what I call a unthought through.
So it's a governance. It's a governance challenge.
The Prime Minister has a very tough task ahead of him. No question about it. This country has a whole tough task. But our task is nowhere compared to the guy who's on the street starving with his family, little children. We need to somehow give them relief. And why, if in retrospect,
yes,
when with the critics that are of that is suddenly in lockdown, maybe we should have thought it through that let the labor go home. Tell them it's 4 or 5 weeks that they will have to stay home. Industries will open in a graduated way and we'll bring you back. The reverse has happened, unfortunately. So that may not have been expected, but it has happened. Now let's deal with that. And there's no point arguing politically over which state is doing what and not doing what. The basic thing is today the blueprint that we have in front of us, red zones, extremely strictly locked down. No question about it.
No, red zones or containment zones. Dr. Trian, red zones or why should the entire Delhi, for example, this is the point Mr. Kejriwal is making, why should entire Delhi be a red zone? Why not focus only on areas within the red zone? For example, in Mumbai, why should entire Mumbai be a red zone? Why not focus on a Dharavi, on a Baikala, on a Worli Kola?
Because it's not an actual wall, Rajdeep. Because it's a tourist red zone.
But then Rahul, if an entire city is going to be declared a red zone, how are you going? You see, how are you going to then restore livelihoods without the trains running? Apparently, yesterday in the meeting, Uddhav Thackeray suggested that the public transport can be used now for essential services. That the trains can be used by those who are seen as essential workers. Who's going to decide that? How are you going to manage that? So I think someone has to bite the bullet. No one is willing at the moment to bite the bullet and saying, look, we have to open up. We know there will be costs, but we are willing to bear those costs.
You know, Rajdeep, you're not concentrating on how to open it. We're not saying don't open it. I'm saying open it. But how well will you manage it? If you manage it the way you open liquor shops, then it's a disaster.
Sure, it's a management crisis.
But if you can do it, that you can run the trains, you can bring in 1/3 of the labor force with proper distancing and masking and temperature measurement before they board the train, fine. Local transport is different than long haul. If long haul is going to be that hundreds and hundreds of people are going to be thrown together for 48 hours, they'll be going to the toilet, they'll be going to whatever they eat, whatever they do, so the risk is higher in those people. If there are short haul trains, yes, you could enforce it, like we are talking about airlines.
Right.
So there are many things that need to be thought. Each activity has to be thought through extremely closely if you want to contain.
No, but we are a very leaky governance superstructure. You were saying, you know, in a hospital it's difficult to ensure that everybody has a mask, even if it's a first-rate hospital. You're saying some poor migrant who's on a truck in 40 degrees Celsius, he'll have a mask on all the time.
Rahul?
He should. He should. He should, there's no question, because then if they want to keep infecting, then you better...
Sir, he is the poor fellow, sir, on the ground, he's having to pay 2,000 or 4,000 to the truck driver so that he can get out, so that he can avoid the police barricades. Let's be honest, this is, sir, as I said, therefore a very difficult country to manage. You're absolutely right that it's a management crisis, it's a governance crisis. But the Prime Minister cannot... The Prime Minister cannot manage that crisis at the micro level. That's going to have to be done by the Havaldar. It's going to have to be done by the railway ticket collector. It's going to be very difficult.
So I'll tell you, this is the moment to throw all the resources we have. There are the local policeman, whether he's overwhelmed or not so compulsive or is exhausted, There are many things that have happened to these forces. So we have reserve forces. This is the time to say, okay, one, we should not victimize the laborers anymore. They should not have to pay and sneak and hide inside cement turners and stuff like that. That's totally inhuman and making it worse. We need to provide them the proper transport. We have decided they can go home and then complete the cycle, then go it full-hearted.
Okay.
Then don't let somebody will stop you, somebody will not stop you. At the border they'll stop you, but they have been given passage from the state. These are all confusions.
Okay.
We must get rid of all this. There should be every activity that we want to do. It should be completely monitored for the next 3 to 4 weeks. If you want to reap the benefit of the last 5 weeks, which we have invested, we should then not let go without supervision. We have central forces. We have the army.
Important.
It is an important point.
So it's a calibrated. From a stringent national lockdown, the buzzword now is a calibrated, well-managed lockdown. So we are, in a sense, moving from one phase of the lockdown, hopefully, to a second phase, Rahul.
What I want to do, thank you, Dr. Trehan. We hope to come back to you once we know what the Prime Minister is saying, but it's always nice to have your insights. I want to show you what's happening internationally, because the same conversation that Prime Minister Modi in about 12 minutes and 30 seconds from now will have with the people of India, Boris Johnson in the United Kingdom, Vladimir Putin in Russia, constantly Donald Trump in the United States are having with their people as well. What are world leaders telling their citizens? What's happening internationally? Let's just give you a sense of how different countries are approaching the same challenge. Here it is.
France is cautiously emerging from one of Europe's strictest lockdowns. The 8-week lockdown that was imposed on the 17th of March has been gradually lifted. Shops and hair salons are now open, and people can now venture out without a government-mandated form. But it's not business as usual. Paris still remains a red zone, and the French government has warned that the lockdown will be reimposed if infections resurface.
If the virus were to resume its wild rush, with lack of control and a risk to French people's health, we would again take lockdown measures, by zone, differentiated, as we have been doing in the beginning, and see if the population is in danger.
In London, traffic returned to the roads as many confused Brits headed back to work. While the British Prime Minister has said that the lockdown will not end yet, he did encourage some people to return to work. From the 13th of May, people will be allowed to exercise more. Some manufacturing workers could also go back to work.
We have made progress in satisfying at least some of the conditions I have given. We have by no means fulfilled all of them. And so, no, this is not the time simply to end the lockdown this week. We said that you should work from home if you can and only go to work if you must, at the earliest by July.
Boris Johnson is expected to give details of how to get the economy back to work after his attempt to plot a nuanced exit from the coronavirus lockdown prompted confusion. Spain has a 4-phase plan to lift the coronavirus lockdown as it prepares to return to normal by the end of June. In Sevilla, bars have started to open as the city enters the 2nd phase of lockdown. Bars and restaurants can also reopen their terraces with no more than 50% occupation. Hotels and other tourist accommodations can also now reopen. Madrid, however, still remains closed as it remains in the initial phase of the plan to ease the lockdown. As China has eased its lockdown measures and gradually reopened its economic activities, major projects resumed in North China's Hebei province and Central China's Henan province. In South China's Hainan province, over 11,700 graduating students from 13 colleges returned to campus over this weekend. Shanghai's Disneyland is all set to reopen its doors to the public. The park, which has been closed since January the 25th, will be the first of 6 major theme parks around the world to reopen since the outbreak of the COVID-19 pandemic. The theme park will implement various health and safety measures as well as limit the number of visitors to 30% of its normal capacity upon its reopening. Bureau Report, India Today.
Okay, so I've just received information from sources within the government that the Prime Minister is likely to announce a package to address the crisis faced by labourers and by industries. That's what the government is indicating. It really is, Rajdeep, the biggest PR crisis this government has dealt with. These migrants on the roads, the Prime Minister likes to believe that he's a man of the people, he's come from the people. To have all these people on his watch marching back home in such pitiable conditions is a deep problem. He tries to address that.
The significance, Rahul, is that when lockdown 3.0 was announced, the Prime Minister didn't face the nation. That was left to the Home Ministry to work out the details. Obviously, lockdown 3.0 failed to address the migrant crisis. I think there was the hope that it would, that construction activity, for example, would resume by allowing workers to remain on construction sites. It didn't work. So I think the Prime Minister, whose political equity remains high, has to now stake that political equity in managing the crisis that he faces among the poor. Remember, I think this is significant and must be emphasized. One of the reasons the Prime Minister did successfully in his re-election was he was able to project himself as a Garibo ka Neta. He did that after demonetization, and he did that in the 2019 campaign also. And if you look at all the steps he's taken, Kisan Samman Yojana, Ujwala, all of that was directed to show himself as someone who's a provider of the poor. In the last 2 weeks, I think that image has taken a hit because of the migrant crisis. And he needs to therefore address that constituency, which he has consciously cultivated. And one of the ways may well be a package. If he is able to provide a package that is seen to be reassuring. Remember, you've got the JAM Trinity in place, the Jan Dhan, Aadhaar and mobile Trinity. Why has it not worked after package number 1? When you gave monies to poor, to the vulnerable, to women, to senior citizens, for some reason, people didn't have confidence. Either the money didn't reach their bank account because I'm an urban poor and my account may well be in my village. There are various possibilities that exist. The poor clearly have not seen the confidence in the Prime Minister, which is why he needs to restore that today.
Look, that's not the only challenge, Rajdeep. A lot of the direct benefit transfers that happen in the accounts of people living in rural India. One of the things the last 50 days has shown is how little we think about migrants who live in our big cities, who don't get the kind of benefits. If you're a farmer, you still get the PM Kisan Yojana, money comes into your bank accounts. These poor migrants working as laborers in our big cities don't get that kind of money, which is why they're feeling the greatest distress.
Absolutely. Either way, I think that the critical constituency which has been most affected by the lockdowns is the urban poor, the urban marginal. And I think that constituency has turned out to be far bigger than perhaps the government even anticipated. And I think that is why those images have hit the government, and which is why today's address becomes important, because unlike lockdown 3.0, now it's the Prime Minister who's fronting this one.
We've got 5 minutes and 50 seconds to go for Prime Minister Narendra Modi to start speaking. I've just received word from the government which says that the Prime Minister will push for good hygiene pledge as attempts are beginning to save the economy, linking personal hygiene with our attempt to try and limit the spread of the coronavirus. The idea is to try and save as many lives as possible as the economy starts reviving. I've just received a flash from Washington Post which says that Anthony Fauci over there is saying if you open too fast, needlessly lives could be lost. He said it in the US context, but that's something for each one of you to bear in mind. And as we wait for the Prime Minister to start speaking, you rush this through because we're getting impatient. It could cause catastrophe.
That is the dilemma that every world leader is facing. Boris Johnson's speech over the weekend revealed that dilemma. At one level, Britain wants to open up. At another level, they are well aware of the fact that if you open up too early, that can cause severe damage. Remember, the United Kingdom first tried herd immunity, it didn't work. Then they went into a severe lockdown. Now there's pressure from various groups to open up. And that same pressure is there in this country as well. So I think the importance of being able to, it's very easy to say, jaan hai to jahan hai, and then also, of course, talk of lives and livelihoods. How do you balance the two? It is an extremely difficult task that awaits Prime Minister Modi, that awaits Chief Ministers, that awaits district magistrates, that awaits Home Ministry and Health Ministry officials. So I think, there are no easy solutions. It's a Hobson's choice. At one level, a lot of people, industry today wants that big package and wants the economic activity to open up. There are health officials who will tell you, look, please be cautious. So I think I think the Prime Minister is faced with a very difficult challenge. In many ways, today is more difficult than even what happened on the 19th of March.
The University of Minnesota put out, Rajdeep, 3 scenarios. And that's illustrative. We've got about 3 minutes to go. What could happen from here on? If you have too many peaks and valleys, if you keep rushing through the whole process of opening up, very soon you could find yourself in a situation where you may have to lock down again. And that's problematic as well. So you have to plan this. I want to show
also because you haven't tested yet enough. You still haven't tested yet enough for a country of 1.38 billion to conclusively say that we have coronavirus under control. Yes, there are lots of hopeful figures, especially mortality rates which are low, but and the fact that the virus is largely confined to a few cities, but that's not enough.
Can I show viewers 3 scenarios that have been mapped up? They looked at 8 pandemics that have struck mankind. They map out 3 scenarios which are important for you to consider as you wait to hear the Prime Minister in about 3 minutes from now. Question number 1, I'll quickly take you through these scenarios. One is that if you open too quickly, and that's what we have to be very mindful of, you could end up in a situation where there's a peak, and as a result of which we have to shut down again. This is the first scenario. So you've had a big peak already. As things start coming under control, if you rush through, then in July 2020 there could be another peak, and then in January 21 another peak. So that's the peak and valley scenario, which means that these peaks and valleys just go on for about a year or 2. You want to try and avoid this. The second scenario is even more problematic. That's what happened in 1918 during the Spanish influenza, where you had a peak in summer, then things went down, and then it came back with a greater vengeance in winter. Towards November, there was a bigger catastrophe. So that again is something you have to ward against. The best option really is scenario 3, which is the slow burn scenario. You try and maintain social hygiene, which the Prime Minister will focus on, and personal hygiene, keep social distancing, and then you have these small waves. So it's the slow burn. We are going to burn, but it better be a slow burn so that it doesn't singe us. I think, Rajdeep, with 2 minutes to go, that's the clear scenario that we have to hope for. There is no victory against the virus. That's why a lot of the politics is completely meaningless. There's no BJP Congress here. We are going to burn. Can we slow down the heat?
You know, there are 2 states which have come closest to the best scenario that you put out, which is Kerala, which has the lowest mortality rate in the world for any part of the world where there are more than 500 coronavirus cases, just 4 deaths, and Karnataka to some extent, where again you've got a state which seems to have by and large been able to put the virus, keep the virus under control. Those states could well claim today, with some justification, that it's worked.
Okay, Rahul Srivastava is telling us, he's a brave man, that he's got some information on what the Prime Minister is likely to say. You have 50 seconds, Rahul, before the Prime Minister actually starts speaking and lets us know whether you had this right or not. But tell us very quickly, what should we expect?
Rahul, there was a question mark over the fact that why is the Prime Minister addressing the nation nearly 5 days before the end of the deadline, unlike the last of his few of his addresses. And there was a factor that when the Prime Minister says that he is likely to address the migrant crisis, that is one crisis which cannot be mitigated by just giving assurances or trying to tell them to stay put where they are. That is why even the states which are going to receive them are in no position to handle them. And that is why an attempt to address it in a wider manner through a macro announcement of some kind of a package which addresses both those people who are employing the laborers and also those who are the employees in terms of the migrant labor could well be in the offing. What sources are confirming right now that there is a possibility that the Prime Minister may be announcing the broad contours of a package. There might be a pledge for the people as the Indian government and the state governments announce.
Does the Prime Minister announce the package, or does he leave it to Nirmala Sitharaman?
So in 7 seconds we'll find out.
50 seconds, Rajdeep. That the point is, as the country eases restrictions, Prime Minister may offer a pledge for good hygiene from all the people, so involve the public in it.
You know, the question is, until now, the reason I asked, until now, all the packages and all the nitty-gritty have been left to ministers and officials to work out. The Prime Minister's speeches have largely given the big picture.
Rajdeep, that's taking
He's given the big picture.
No, but it's his image that's taking ahead.
Now, you know, giving a pledge for good hygiene is all very well, but if I'm sitting on the back of a truck, 100 people